Good afternoon, dear children. Welcome back to the obstetrics and gynecology class. So, in the previous class, we have studied about the pelvis and we have seen about the pelvic joints and as well as the ligaments. In our today's class, we are going to further proceed with the next part of the pelvis, that is the false pelvis and the pelvis. So, the outline in this class, we are going to see about the true pelvis, the false pelvis, and we are going to see the landmarks of the pelvis. Then about the diameters of the brim, we are going to see. Okay, the first part only, that is the diameter of the brim, we are going to see, and the cavity and the outlet. Okay, so when we speak about the pelvis, we already studied the bones, we studied the joints. Okay, we have studied the ligaments. Okay, so when we studied these many things, so now we it is the time to study about what is actually the true pelvis and what is actually the false pelvis. Why we do say it is a true pelvis and why do we say it is a false pelvis. Okay. So the objectives of the class will be to understand or also explain about the what is true pelvis, what is false pelvis. Then the student will identify the various landmarks of the pelvis also and the diameters of the. Usually, this will be the 10 marks question, or you will say even the 5 marks question also. Explain about the structure of the pelvis, or even if they may ask and the false and the pelvis. Okay. So, when we say the structure of the pelvis, so how we divide it? We divide it as it is either the false pelvis and the true pelvis. So, the pelvis is being divided into two category, that is the false pelvis and the true pelvis. Now, what is false pelvis and what is true pelvis? Now, the false pelvis. Okay. So, false pelvis means it is formed by the upper flared out portion of the ilium. So, we have seen the ilium and the symphysis. Is it one? So, the upper flared portion, okay, the above portion of the pelvis, like a bowel shape. That upper portion, whatever is there, means there is a circular where it is joining. There it is a circular above portion, flared portion. We are calling it as what? The ilium. So laterally, we are the lateral aspect. We do have what? Yeah, fossa we are having on the lateral aspect. Okay, and that is on the back aspect. Then on the posterior, we are having the fifth lumbar vertebra. That is the backer aspect. Laterally on both the sides, we are having the iliac fossa. Posteriorly, we have the fifth lumbar vertebra, and anteriorly we have what? Abdominal wall, or you can say, and also the inguinal ligament. Means the false pelvis is formed by how many sides? Laterally by the iliac fossa, both the sides. Posteriorly by the fifth lumbar vertebra. Anteriorly the abdominal wall and the inguinal ligament. Okay. So now what is the use of this false pelvis? It is protecting the abdominal organs. Okay. And there is no any aesthetical importance. Only it is providing certain landmarks to perform the external pelvic. For that purpose only the false pelvis is. Okay. So it is the flared portion, that is the upper flared portion. We are calling that is what? Ilium. And laterally, that is the fossa is there, and posteriorly fifth lumbar vertebra, and anteriorly the abdominal wall and the inguinal ligament. Okay, it is protecting the abdominal organs. So next is the true pelvis. Okay, so now we have seen upper portion is the false pelvis, and just below that we are saying it as the true pelvis. So what is true pelvis now? The true pelvis is the bony canal through which the fetus is passing during the childbirth. Means this is the actual area where the baby is going to pass the birth canal. Okay, that we are seeing here because what it is called as the true pelvis. So this true pelvis is again subdivided into what? Three parts we are dividing it. That is the brim, the cavity, and the outlet. Okay. So brim is the circular one. We are calling it as the brim. The cavity is where it is cavity means it is that also. And outlet is means the ischial tuberosity, both the ischial tuberosity, the symphysis pubis, and the coccygeal end. They all together form the outlet. Okay. So this true pelvis is being divided into the three parts. Okay. So here means the true pelvis is very important because this is the area where the fetus is going to pass through the child. It is having three: brim, cavity, and the outlet. So now let us see one by one. So now we are going to see about the pelvic brim. Okay. So we also call it as what? Inlet. Inlet, cavity, outlet, or we may say also brim, cavity, or outlet. Okay. So now we are talking about the pelvic brim or the inlet. So it is formed by the sacral posteriorly, then the iliac bones laterally, and the pubic bones also anteriorly. How the pelvic rim or the inlet is formed? It is formed by the sacrum. Okay, what all are there when the pelvic rim is formed? Means backside we are having the sacrum, and the iliac bones are on the both the sides. We are having the iliac bones and the symphysis pubis on the frontal aspect, that is the anterior aspect. So all these together they form what? They form a pelvic brim. It is formed by posterior sacrum posteriorly, the iliac bones laterally, and the pubic bones on the anterior aspect. The how it is the shape? The shape is almost all rounded, okay, and with the anterior posterior diameter is being the shortest one. So how the shape of the brim is there? Usually the shape of the brim is a rounding shape, okay, and on the anterior posterior diameter is what? The anterior and the posterior diameter of the brim is very shortest. That is the shortest diameter in the brim. And we are also going to see about the diameters of the brim also. Okay. Then it is having the boundaries. The boundaries, its boundaries are what? What the sacral promontory is the boundary. Then the wings, okay, that are behind that the sacrum, where the sacrum is there, that is the sacral ala wing we say, no? That one. Then it is having the iliac bones on the sides of the pubic bones in front of. So here you can see the sacral promontory, the ilium both the side, okay, and you can see the symphysis pubis. So this complete red color which you are seeing, that you can say it as what? The brim. Okay, so the here the highlighted portion, the blue color the sacral promontory, and this you can say that it is the crest. Next, we are moving on towards the very important. It should be on your tip of the tongue, and you should by heart this, and you should understand where are these actually bones present. Okay, so a very important aspect of the pelvis you need to understand, because on this whole landmark only the whole delivery process is also based, and without knowing all these alignments, it won't be able to understand about the position of the baby, the uterus. Okay, so that is the landmarks of the pelvis. Okay. In the landmarks of the pelvis, we are having total 8 important landmarks. Okay. How many? There are 8 important landmarks. Now you can just see in the picture I have named it as A, B, C, D, E, F, G, and H. Okay. Then we are going to see one by one. What is what? Okay. Now just focus on point number A. You can see the point number A. The point number A is the landmark. That landmark we are calling it as what? Sacral promontory. Try to pronounce the word also and the spelling also. It is sacral promontory. Okay. Then just can go to the next point. That is the point number B. Just on the side of the promontory, you can see the wing-like structures are there. So those wing-like, like this one is flared structure. So this structure we are calling it as what? Sacral ala or sacral wing we call it. Okay. So the third landmark, point number C, it's been highlighted. You can just see the point number C. You can see a black line is there. Okay, so this black line where the C is pointing, this particular line we call it as what? Sacroiliac joint. Okay, we have already seen this joint. Means the sacrum is getting attached to the both the sides on the ilium. So that's why it is the sacroiliac joint. Next is the iliopectinean line. D. Okay, where the point D is there, there is there is an imaginary line. Okay, you have to just find imaginary line, and that imaginary line, what it is called as what? Iliopectineal line. Okay, then just you can see there is a eminence, means there is somewhat some thickening like structure in the pelvis. Okay, just next to the iliopectineal line, that we are calling it as what? Iliopubic eminence. Okay, what is that? Iliopubic eminence, that is the thickest one. Okay, next just look at the point number F. Okay, that we are calling it as what? Pectineal line. Okay, F point is what? Pectineal line. Next, point number G, you can see that is the pubic tubercle. Okay, pubic tubercle. And point number H, you can see that is the pubic crest, where the pubic crest is there. That is the H, we are seeing it as symphysis pubis. Crest means where this inferior rami and the superior rami are joining together and they form a arch here. You can see it as the pubic artery. In some books, they write anterior rami, superior rami, and the pubic symphysis pubis also. Different are booking, but almost all the landmarks are 8 landmarks only. Okay, you should remember these 8 landmarks. Okay, so which are those 8 landmarks? Sacral promontory, the sacral ala or wing. Okay, the sacroiliac joint, iliopectinean line. Okay, iliopectinean eminence, pectinean line, pubic tubercle, pubic crest, and symphysis pubis. Or even in some of the books also they say upper inner border of the symphysis pubis and upper outer border of the symphysis pubis also. Different books may be saying, but the symphysis part is the one part. Okay. Now after seeing the landmarks of the pelvis, now we are moving on towards the diameters of the inlet, or also you may say the diameters of the inlet. So how many diameters we are having? We are having 3 diameters in the ring, or you may say the inlet. Okay. So which are the 3 diameters? The 3 diameters are the anterior-posterior diameter. Means anterior aspect and the posterior aspect. We draw an imaginary line that we are calling it as what? Anterior-posterior diameter. Then we have a transverse diameter. Means in between the two iliopectinean lines, what there is there, there is one imaginary line drawn that we are calling it as what? Transverse diameter. Then we have the oblique diameter. We are going to see in depth about this from where to where these imaginary lines are drawn and what are they important for. Now speaking about the anterior posterior diameter. So how much is the length of the anterior posterior diameter? It is 11 centimeter. Okay. So anterior aspect and the posterior aspect, they are on an imaginary line is drawn, that is 11 centimeter. So how it is from? It is a line from the sacral promontory. From where to where we are drawing it? We are drawing an imaginary line from the sacral promontory to the upper border of the symphysis pubis. Means imagine this is the symphysis pubis. So on the upper, on the top border of the symphysis pubis, we are drawing an imaginary line. Okay. So that we are calling it as what? We are calling it as anterior-posterior diameter. Try to remember the words from where to where. From the sacral promontory means where the bulging of the sacral promontory is there. From there to the symphysis pubis upper border we are drawing it. Okay. So that is the anterior-posterior diameter. And the length of the central posterior diameter is how much? It is 11 centimeter. Okay. Now, there are actually we are having the three conjugates in this anterior posterior diameter, and these are very important even when we are performing the vaginal examination also. So the first thing is the diagonal conjugate. Okay. So now what is diagonal conjugate? Okay. When the distance between the lower border of the symphysis pubis to the midpoint on the sacral promontory. Okay. From where to where we measured the anterior posterior diameter from the upper border of the symphysis pubis to sacral promontory, that was the anterior posterior diameter. If we draw the same line that is from the sacral promontory's midpoint to the lower, on the lower aspect, okay, lower border of the symphysis pubis, that in particular we are seeing it as what? Diagonal conjugate, and that is 12 centimeter length. Okay. So then the next diameter of the anterior posterior is the obstetrical conjugate. It is the distance between the midpoint of the sacral promontory to the prominent bony projection in the midline of the symphysis pubis. Okay. Up is anteroposterior diameter, below is diagonal conjugate, and in between this symphysis bone point, in the center point if we are measuring, that is from the midpoint of the sacral promontory to the prominent bony projection, where the more prominence of the this symphysis pubis is there. So that we are calling it as what? We are calling it as obstetrical conjugate, and that is around 10 centimeter in length. Okay. Next is the true conjugate. So what is true conjugate? The true conjugate is it is extending from the sacral promontory to the top of the symphysis, from the point of the sacral promontory to the top point of the symphysis pubis. So it is almost all measuring 11 centimeter or even might be more. That is what is our anterior posterior diameter. Hope so the anterior posterior diameters are clear. We are having three anterior posterior diameter types. That is the diagonal conjugate, obstetrical conjugate, and the true conjugate. Then we have the transverse diameter. Okay. So the transverse diameter is 13 centimeter. Okay. So now we saw anterior posterior, that is the backer aspect, and the frontal aspect, that is 11 centimeter. Now transverse diameter. Okay. Transverse diameter is 13 centimeters. From where to where it is drawn? It is in between the two farthest points on the pelvic ring over the iliopectinean lines. Means where there are two iliopectinean lines, we have already seen in the landmark the iliopectinean line. So in between these two iliopectinean line, an imaginary line is drawn that we are seeing as what? The transverse diameter. Okay. So the next diameter is the oblique diameter. So what is oblique diameter? So the oblique diameter is means it is oblique, left oblique and right oblique, two oblique diameters will be there. They are around 12 centimeters in length. From where to where they are? From the sacroiliac joint, okay, where the sacrum and the ilium is joint from there to the opposite side of the iliopubic eminence. Okay, means from one side sacroiliac joint to the opposite side of the iliopubic eminence, the thickest part I said. So there an imaginary drawing is drawn. So there we are calling it as oblique diameter, both right side and as well as the left side, right oblique as well as the left oblique. So here is the picture of this three diameters. Okay, so you can see here the anterior posterior diameter, that is from the sacral promontory to the symphysis pubis. Okay, upper border of the symphysis pubis, that is around 11 centimeter. You can see here the transverse diameter, that is in between the two iliopectineal lines, is the transverse diameter, and the oblique diameter, that is from the sacroiliac joint to the opposite side of the iliopectineal eminence. That the right and the left oblique diameters. So this is what is the diameters of the pelvic. Hope so the things are clear here. So in the upcoming next slides, we are going to see about the diameters of the cavity and as well as the outlet also. Okay. So here I end up with. So the exercise is that is we need to explain what is the true pelvis and the false pelvis, and enlist the landmarks of the pelvis with table diagram and the diameters of the brain. Okay. The learning outcome we have attained is about the what is true and false pelvis, landmarks of the pelvis, and the diameters of the pelvis. That's all. I end up with my class. Meet with the next some more diameters, that is the inlet and outlet diameters. Till then, take care. Thank you.